First of all, people listening on the internet, don't switch off. It's not me again. I'm just introducing this evening's discussion, which is on the subject of health. We have these meetings once a month to discuss a variety of topics because we still see value in face-to-face discussion. So, shall we do a brief round of introduction? No, because we're recording.
Yeah.
So, without further ado, I would like to introduce our speaker, without giving his name. He's going to talk to us on the subject of health.
Okay, hi people. My name's Andrew. Tonight we're talking. Tonight we're talking about crisis in the NHS. I've experienced the NHS as a patient, as a hospital porter, and as someone who's worked in health and social care for over 20 years, mainly with people with disabilities. Okay, maybe it's useful to. Well, first of all, is there a crisis in the NHS? Well, I think there is, but at the same time, I think there isn't, in the sense that I think it's artificial, but we'll come back to that. But yes, there definitely is a crisis, but yeah, it's one that stands closer examination. Right, what is the NHS, first of all? NHS is sort of started after the Second World War, or came into full steam after that, and it was really created as a result of the state finding that over quite a period of time that the state of people's health, ill health and poverty was such that they would find it difficult to find enough fit and healthy people to fill the armed forces. So that's how it came about, and also, of course, after the Second World War, it was a means of the social contract, if you like, for appeasing people for the sacrifices that people had made for the Second World War. Interestingly, we'll come back to this. As part of the NHS, private patients and beds were retained in it from the start, so that's always been a sort of worm in the apple of the NHS. And of course the fundamental principle of it is one of universal health, free at the point of delivery. So it's the idea that everyone should have access to health, whether they're rich or poor. Okay, is there a crisis in the NHS? Well, there is. And why? What's the nature of that crisis? Well, it's costs a lot of money for a number of reasons, which we'll look at briefly. It's very dependent on drugs, and drugs are expensive. And one reason they're expensive is that the big drug companies make a hell of a lot of money out of them. It's also very high tech, so that costs a lot of money, all the sort of machinery and things, scanning machines and what have you. Also, as we're constantly being told, that we've got a number of things happening at the moment, like an ageing population who selfishly, living longer, and so they're such a drain on everyone. We have growing problems in the population at large of obesity, which has big implications for health, and expense, if you pardon the language, and also things like cancer. There's a lot of that around. But fundamentally, the point is, we have all these problems, and something else I'll come to in a second. But our argument is, yes, they cost a lot of money, but what sort of society can't look after people who are unwell, won't look after people when they're elderly, and we say, those things are fundamental, and there's enough money. There's £100 billion for Trident. There's any amount of money for all sorts of other nonsense, like the royal family and that. So there are enough resources. It's a political thing rather than a resource thing. And one thing I haven't mentioned, an elephant in the room, if you like, is the private finance initiative. Now that was interesting enough. It was a Labour idea that they didn't really implement, and then the Tories have taken it up. And basically, it's an accounting scam. It's a way of governments building new hospitals and things, and and on the books it doesn't look as though they're spending a lot, but of course they are paying for them over a period of 60 to 90 years, because they then have to hire them back from the people who build them. So they're actually ending up in the long term paying a hell of a lot more than they would otherwise pay, and that is one of the things that is bankrupting health trusts and things. Right. The other problem facing the NHS is the fact that cuts in the NHS, although it's supposedly one of those things that's ring fenced, that we won't make cuts in frontline health services. They're
very sorry. Not here.
The reality is that there are a lot of cuts being made in terms of hospital closures, closures of parts of hospitals like accident and emergency, not enough nurses and doctors, all those sort of things. So that is the reality, and yet of course, as we've already seen, there's more and more demand for NHS services because of the factors we've looked at, and because the population is getting bigger. The cuts again are political because there are sufficient resources for there to be decent healthcare for everyone. It's just whether they're devoted to it or not. And part of I would argue that the main reason for the cuts is ideological. We're being asked to pay for the crisis in capitalism, the bankers' crisis, but also this government in particular, not that it's wildly different from the New Labour or even Labour under Miliband, is that they want to really cut back on the welfare state and that, so that and privatise everything. So they make cuts, and then there's chaos, as we're seeing a degree of chaos as we're seeing at the moment in terms of waiting lists and accident and emergency being very oversubscribed, and all those sort of things, people having to wait enormous amounts of time for operations, and then they blame it, rather than blaming it on the cuts and insufficient resources, they blame it on the system itself. I mean, it's quite similar to what they're up to with schools, saying that schools are failing, so we've got to have an academy. So I think it's quite similar, really. Okay, so I thought briefly we'd look at health, what health is, because it normally helps if we know what we're talking about. Health I'm defining as physical and mental well-being, and really we all suffer, however well and young and sprightly we all suffer ill health over our lifetimes. Most of us suffer some form of depression as well, and we're guaranteed if we get into old age we're going to suffer some form of disability as well. So a health service is something we all need, and that of course is putting on one side people who are born with major problems, who are born with disability or born with illnesses which limit their life. They might not even reach adulthood. But wider than that, I think we can see what do we need to be healthy in the fullest sense of the term I've just defined. well, I think we need friendship, we need love, we need solidarity, we need other people and their support. We need to be reasonably fit, we need clean air and water, we need a healthy food and diet, all those sort of things. We also need a reasonably healthy surroundings in the wider sense of the word, you know, not to be stressed by poor housing or crappy jobs, not to be suffering bullying, not to be suffering sexism and racism, all those things. So what I'm trying to outline is we live in a very unhealthy society, you know, which makes us unhealthy, and part of getting somewhere different is improving our conditions in that sense. But also I will come on to, I think, although we definitely need to fight attacks on the NHS, I think we need to be critical of it and to have strong ideas of what we want in the future. Right, privatisation. I've said the NHS is being privatised. Now, despite what they say, all the mainstream parties are actually committed to privatisation. It started under New Labour with the introduction of the internal market. The Conservatives and Lib Dems are carrying it on with a vengeance, and UKIP are certainly for it. I haven't looked at the policies of the other parties, but I'm pretty damn sure they all support it, with maybe the Greens don't. But anyway, the reality of it is that they are, all the main parties, committed to it. So just look a bit at the actual content of privatisation. It's sort of decentralising and franchising so that it can respond better to innovations in demand and supply. It's giving the management, more managers been introduced, and they've been empowered to reduce the costs of labour, remove the obstacles to profit in the medical industry, and ensure there's a more sensitive medical policing, or customer care as they call it. And their first target was the guild power of the medical profession, and they applying cost benefit analysis to everything. And also the industrialisation of time and motion studies. So they've been applying that to nursing. A unit cost is worked out on the basis of the grade of the nurse and the time taken for them to do a task, and that gives them greater control of nurses' working time, and it enables them to increase nurses' productivity. Also, they rationalise the nurses' work, and all that means that they can also facilitate the introduction of unqualified staff, healthcare assistants. So these reforms have accelerated hospital specialisation. Sectors of chronic and long-stay patients have been subcontracted to the private sector for care, so the elderly would be one obvious example of that. And hospitals have shed their charity and care roles, and which have been dispersed into the community, but I'm sure we can get on to discussing that later. That we have this phrase care in the community that they've been banding around for the last 20 years or so, but I would say what care and what community, because when you actually look at it, those are the fundamental questions. You know, probably most of us know home visits for the elderly. Currently they're supposed to visit people for 20 minutes to do tasks like helping people out of bed and helping them make the breakfast or whatever, but the reality of cuts is that they aren't allowed any time travelling between patient A and patient B. They aren't even paid petrol money or anything, so they actually end up spending as little as 5 to 10 minutes with people and only being able to give them do some of the tasks they're supposed to do. So that, you know, this is the grim reality of cuts and care in the community. That's just a little snapshot, if you like. So basically, the modern hospital is a specialist health factory applying a cost-benefit analysis to all its operations. It's all about high-tech interventions and being a scarce resource. And really, we can see, despite all the talk about cutting back on the welfare state, really the reality is that our taxes are being funneled to the private sector. It's a welfare state for the private sector. Okay, right, just to end on a few ideas of beyond the NHS. So some ideas of, what sort of health service in the wider sense of the word, would we want to see, and what criticisms do we have of the health service as is. I think the women's movement has come up with a lot of things about criticisms of the health service in particular, which I'll come back to in a minute, but I've already spoken to, pointed out that the health service is very drugs oriented, and they are, that's only tackling one part of things, and it's also a big expense. If we think about it as well, all drugs have other medical drugs have other effects than that for which people take them, and the drugs industry has put a little heading on that of side effects. But if you actually pick up your medication and look at it, some of those side effects are pretty frightening, So. Yeah. So I think it's really twofold if we're thinking of what sort of health service do we want. On the one hand, it's saying health is a wide, holistic issue. We've got to look at the social context. So we need decent housing and workplaces that aren't stressful, and clean air and water and all those things. But also saying we want things to be patient oriented, and we want people to know about their own health. The women's movement came out with things like Well Woman clinics, which are about that, which is about small scale educating people about their own health and how they can look after themselves, as well as supporting them. And that's the sort of thing I would suggest that we want, and community hospitals in a similar vein. Right, I think I'm going to shut up there so we can have a discussion.
Okay, so questions, comments?
I was going to come back on. You talked about the founding of the NHS. I think the way you conveyed it was a little bit wrong, because you said that it was there to make sure people were healthy to fight wars, and I think the view was after the Second World War that there probably wasn't going to be another substantial war for any period. I think the reason, that's by and by, but the reason I think it's important to look at the founding of the NHS is because a lot of the left, they build a very rose-tinted view of how the NHS came together, and it's a linchpin within how they see, social democracy or the Labour Party or whatever. So I think it's important to go back to the NHS and also to understand, for us as anarchists, what the nature of reforms means, and defending something that's decent that the government offers without being sucked into the dead end of Parliament and all the rest of it. And what's worth pointing out is that the NHS, it wasn't just kind of this big, on high sort of concept that Attlee and Beveridge and various other people got together and handed down to the masses. It was actually forced on them by several means. One was that the private there was a lot of private institutions, i.e. Welfare associations. I heard that miners, they had a similar facility for welfare clubs that already were part of the proto NHS, and the NHS just sort of universalised them and picked them up and put them into one package. So certain aspects of it existed as private clubs, as an attachment of the workers' movement in a sense, and it was just formalised by the state. And what else? I think it was important. In terms, you mentioned the social contract. I think it was important to understand the nature of reforms in that particular period, because we had the threat of the Cold War.
Yeah.
We had when people came back from when people were demobbed after the Second World War, there was a housing crisis, and a lot of these things they sort of agitated and pushed back certain boundaries that the ruling class were willing to accept, and therefore they were able to offer a lot of reforms. And then the continuing threat of the Soviet Union possibly pushed and allowed some sort of I don't know if you want to call it cleavage or whatever, or some sort of baggage where they could throw us more scraps. And the problem is now is that it seems to be the overarching trend in global politics has shifted, where they can just sort of attack because we're in a process of crisis. And it's the question. The ultimate question is how do we get the state? How do we defend these reforms that already exist? Without running parliament, running candidates or calling for votes for this person, this person, this person. How do we defend what already exists in a credible way? And that's kind of going to be a really big question. So I'll just throw that out.
I think there's a lot of truth in what you say. I did sort of concertina how the NHS came about. I mean, they discovered when they came to the First World War that people's health, the poverty and the ill health were absolutely chronic in terms of them trying to get enough fighting people. And then that's when some of the things that behind the NHS started, and then it really came into being after the Second World War. But I think what you've just said is really the core of what I'm trying to say, is that we do need to fight to keep hospitals open and things, but in a critical way, because they're far from ideal, and if we got together with people and said what sort of what sort of healthcare do we want, it wouldn't be the system we have, even like pre-cuts. It would be a different thing. As that's partly what I was talking about the women's movement, because they came up, the last wave of the women's movement, they came up with that stuff 20-30 years ago, as to how people, in particular women, were treated. There have been changes, but there's a hell of a lot more needs to change. I know when I was a hospital porter, you'd take someone for an ultrasound to see about their baby, and they weren't even allowed to look at their notes, and that's changed in that time. That's good, because I was thinking ridiculous. Can't. So
I think the sort of imagined role of the Labour Party in these sort of social democratic reforms is the point at which we have to kind of remain critical and sort of make sure that narrative doesn't dominate, because whether or not the Labour Party is going to reduce cuts compared to the Conservative Party, I'm not convinced that will. But they're going to push this idea that we create the NHS in the same way they'll push this idea that we create social housing, and all of these sort of these reforms. They completely push away the history of the fact it was people struggling. I think that's the narrative we need to make sure people are aware of, that if you want these kind of reforms, you don't go begging to the Labour Party. You get out on the streets, you organise amongst yourselves, because that's what it's what we were talking about housing the other week. It was the Glasgow rent strikes in 1916. It wasn't the Labour Party just went, oh, we're going to be lovely to people. No, it was because of people actually getting out on the street and and actually making things happen. So yeah, not allowing the Labour Party to use it just as part of its electoral strategy.
Yeah, I mean the thing is defending like the welfare state. Of course, like, you know, I agree that I get the impression at the time these reforms were clearly given to pacify, you know, the insurrection that was happening. It was to, you know, to refabricate consent for the ruling class. But, you know, the welfare state in its nature creates a massive dependency towards what we are trying to abolish, well, one of, you know, the state. So I find it, you know, it's hard to, even though, like, I don't want it to be privatised, but to go all gun-ho, like, let's defend the NHS, when it is not community run. You know, it's run by the state, by the class of managers. This has gotten worse, like in all public institutions. They bring in private management techniques under, like, new public management doctrine or whatever. They do it all over in each sector. Decreases the efficiencies of these sectors, because when you're talking about how much it costs, actually, is you see up until 2011 it's quite like constant. It's like 5-6% of the GDP. And then once they started really introducing the reforms, like private sector style reforms coupled with subcontracting out to the private sector, it's gone up to 9 or 10%. And I don't think we've all suddenly got, you know, in our 90s, you know, so, you know, this is all a part where, yeah, I think ultimately what's happening is it will bring it to a state where they will do the trump card of, look, it's so ineffective, let's privatise it. But I agree, I think we should be militating on, you know, the grounds of the community-run hospitals and run by the doctors, the nurses, and also, you know, really open to the feedback of the people who actually, you know, use these services. But, you know, the question is, yeah, how do we actually get to this point? Well,
I'm someone else who worked in hospitals. I worked in 3 different hospitals actually, 2 in London, one in London and 2 in other parts of the country. And this was in the 70s, and the hierarchy was appalling. And there was this arrogance of the nurses towards the ancillary workers, towards hospital porters, towards the mortuary attendants, the CSSD assistants, all of those people. And that broke down to a certain extent with there was a wave of ancillary worker strikes, and you know, they realised that the health service depended on those ancillary workers. And that was broken down to a certain extent. I imagine, well, I haven't worked in it since, you know, since the 70s. I imagine that it's got a lot worse, the hierarchy. If you're going to take a look at the health service, you've got to, what the main thing is actually break down that hierarchy, you know, between the doctors down, and of course right at the top, all these administrators. This top heavy level of administrators who are extremely well paid, who are enforcing all these rhythms, time and motion stuff, you know, Taylorism, Fordism, this sort of stuff. The other thing about the birth of the NHS, you know, as people have said, you know, it's partly to appease the social unrest that happened after the end of the war. You know, people came back, and also the people who were at home, you know, were discontented. You know, they sacrificed themselves. A lot of people had died, so they had to head off any unrest by giving them that. But you know, it's seen as a sort of socialist thing, in inverted commas. You know, it's seen as a Labour thing. But if you look at other countries in Europe, the same sort of reforms are brought through. In France, the same sort of reforms, you know, nationalisation as well, which is what Labour did here, brought in by Gaullism. You know, and that was hardly a socialist. You know, you got that film, that Ken Loach film, that wax lyrical about the good old days of you know, how the Labour instituted this new welfare state, and you know, it's a sort of dewy-eyed load of bollocks, basically. this is what the left, the left, which is totally bankrupt, constantly harks back to. It's always tied to Labourism, and in the end, it's tied to a Labour victory. A lot of these groups will say at the next election, "Oh, you've got to vote. Hold your nose or whatever." Close your eyes and vote Labour, which is complete and utter tosh, because they're going to promise the same as the Conservatives. So you do have to have a vision of a different type of health service, as you said. The women's groups help sort of pioneer that sort of thing. It's got to be completely different. It's completely different, and. As you mentioned, there are the problems about how it's used. The health service, education, etc., are used to justify the state, because the state is no longer the seen as the what used to be defined as the armed body of men that's there to protect the rulers of the ruling class. But it's also somehow seen as something benevolent that it hides behind. Obviously, with all the privatisation that's happening now, that's less and less the case, and the state itself is shedding all of that. So I think I think that really the key thing is the transformation of the health service itself.
No.
Oh, sorry. So, and I'll finish then.
I think also part of the attack is saying that all the time they're trying to say different groups aren't deserving of care and support. So it could be, smokers aren't, that they're all the time trying to define health as a purely individual thing. You live in a little bubble of your own or something. So if you're a smoker, unless you totally give up smoking and whatever, then it's down to you. And should the NHS really be bearing the burden? The same for people with drink problems. The same for people who are obese. Although really it's only about poor people, because obese rich people, it's not an issue, is it?
No.
So I think all the time they're trying to expand that group of people. I mean, we haven't yet had the elderly, because that's a sort of grey vote, but it's happening in the sense that they've, like a lot of elderly in care homes, but they also, if you think about it, it's there as well, because these blinking elderly people, they're bed blockers. They're staying in their hospital beds. Well, if any sort of caring society would look after them when they need to be in hospital, and then there'd be proper support in the community, because we actually would have a blinking community, not be throwing them out to die out of sight in their own homes or whatever. Sorry.
I was just gonna maybe go back to something else you said. Sort of the interrelatedness of the issue of health, and how the built environment and the social environment around you influences you a lot, and also I would say maybe we should start following the advice given by the scientists and the doctors. For example, I suffered from mental health issues, and my psychiatrist would often say to me, well, the causes of a lot of the problems she was seeing escape the control of the individual. So it's the money problems, the stress, the alienation and all of that. So it's also, this is a sort of issue it's very hard to address without addressing wider deep-seated issues in society. But maybe one step would be to start saying, well, health is no profit to be made out of it. Just that, and the pharmaceutical companies, because I think that you were really right to highlight that, the stranglehold they have over any health service that we could put in place, as long as the research and the development of drugs, but is controlled by the ruling class and transnational capital. We're going to get fucked, and we know this because we're going to have to sponsor. We're going to have to back all the investment for the new round of research into antibiotics, because they haven't been bothering to research anything since the 70s, and the antibiotics are you're losing their efficiency. But to develop pills for mental health or for depression and for heart conditions or anything that has a longer lifespan than 14 days, or more profit to be made. No, they pour tons of money into that, and so there is a decouple between what we actually need and what they're producing and researching.
I think sort of to go back to what you were saying about even before the cuts, things were not exactly perfect. I think we have to be careful not to just fight against the cuts as though it's just the cuts of the problem. We should have a sort of a more of a positive program that says people have deserved better than this. Always, it doesn't. You can show sort of like charts saying, oh, the NHS is one of the best healthcare systems in the world. It could be a hell of a lot better for everyone. It always can be. Just because you've been given something good in comparison to some of the other shit that people have to put up with in the rest of the world doesn't mean that you have to stop there and go, oh well we're satisfied with that now, we're placated. Like you said, there are whole swathes of people with like more serious conditions, with older people, with physical disabilities and stuff. That we could have a hell of a lot more care for these people, and it is partly. I mean, obviously it becomes difficult talking about this in if we're imagining some sort of like anarchist society or whatever, then obviously we're not really necessarily going to be talking about the funding of the NHS, so it becomes a complicated sort of thing to try and.
Sure.
But
I think if we just say resources, because there are not, resources are primarily people and
infrastructure.
Construction and things. There are suddenly a lot less people to build hospitals or health facilities or start people to staff them or whatever. So it's a political and a financial decision, isn't it?
Yeah, no, I mean, to go back again on something, I think, the way mental health care is addressed in this country is terrible. I mean, I had to, last year, I was going back to Belgium to see a psychiatrist because there was so much of a waiting list. Like they were saying, if you're not suicidal right now, I'm sorry, we don't have any appointments for 4 weeks. And, and so, yeah, and then of course, before I actually found a psychiatrist who, her first reaction was not to say, well, take these meds and these meds. I saw 6-7 different people who after 20 minutes was like, oh no, you should be on this, man. Take this and this, and so we've got, for example, I know more about Belgium at that level, but it's the most medicated country in the whole of Europe, and especially antidepressants. The whole segments of the working population drugged up. All their senses toned down. I was on these stuff for years, and it's really awful stuff. It can help at certain points, but people who are basically completely addicted to these medications just to survive through a day, and 10-15 years of taking these, and no sort of plan to get them off it, or any alternative forms. What is the NHS doing about this? Even beforehand, nothing.
Well, I mean, they've been cutting back on mental health for years and years, and that's chronic.
Yeah,
that's the origin of because that phrase "care in the community" dates, I think, back to the mid-80s, where there was these like huge cuts in the NHS that involved closing down the old Victorian mental asylums.
Yeah.
Now, we're not going to be out there on the streets saying, bring back the asylum. And I think that's like the best example of we're not, that's one cut. Not a financial cut, but to get rid of those Victorian asylums. But then those people that were in those Victorian asylums didn't go away, and this phrase was invented, care in the community, but there was no care and no community. And a lot of the people in those Victorian asylums or who would be in those Victorian asylums are still in the care of the state because they're in prison. I've only had experience of one prison, touch wood, but in that prison, even the screws said that 1/3 of the inmates had a diagnosable mental health problem. Like 1/3, and those are obviously like the more serious end of the spectrum. And in Tower Hamlets have just advertised the contract. You could make 144,000 quid over 2 years for delivering mental health services to street homeless people in Tower Hamlets. And previously, those people would have been in, they would have been in asylums. The problem's not gone away, but it's sort of like, sort of new Labour version of mental health care. You have like an agile team led by management consultants that go out onto the streets and find people.
Well, actually, when I was coming up here today on the radio, you had an ad for people suffering from depression, and what was their solution? It was have a chat with your co-workers over a cup of coffee. It was really that, like, talking helps. This is their solution. And in a workplace where they're dividing workers up and turning them against each other, where most people, there is not that sort of solidarity that used to be present in a lot of the workplaces. And even from just a perspective, talking about
but also mental health is a taboo, isn't it?
Exactly.
I think most of us would be wary of, you might talk to your close mate or something, but you're not going to want to talk to everyone in the workplace, and you're not going to really want to flag it up to management either.
Especially.
Oh, please, it's another stick to beat me with.
It's kind of moving a little bit away from the NHS, but thinking about how we talk about work and mental health, there's this sort of narrative of like, work is good for your mental health. If you're unemployed, it's bad for your mental health. And yeah, I've been unemployed, I've been on benefits, it's not nice.
Mm-hmm.
But there's very rarely any acceptance of the fact that sometimes work is actually worse for your mental health. If you're overworked, if you've got shitty work, if you're underpaid, and particularly with all these other factors, we were talking about housing and so on, work can actually be even worse for your mental health than unemployment. And unemployment is actually only bad for your mental health because of you're forced to work. It's not it's not some sort of like human nature needs to work 9 to 5 days a week. That's part of the whole system.
Yeah. And especially to bring it back to the NHS, the workers in the NHS, their work is creating massive mental health problems for these people. Like the stress they're under. It's incredible.
And also the whole culture is more and more of a bullying culture. You've got all these managers in, they're trying to get more and more work out of people, the fewer and fewer staff. There's a whistleblowers, people who actually say, look, there's a problem here of corruption or whatever, something that should be addressed, that's a major thing, that they end up being sacked and all sorts, so that's really bad.
It's a pattern happening all over.
It's not an easy job anyway. Probably most of us know that there's a lot of. When I was a hospital porter, I was always surprised the number of doctors and nurses who smoked, and that was in about the 70s. But it's a really well-known thing that lots of doctors have a drink problem, because it's bloody depressing. All you ever see are sick people. Might be your family or whatever. Oh, it's another sick person. Oh God.
Yeah. It's like my little sister's training to be a doctor, and it was like when she went after her first month or two in a hospital, I was like, how does it go? And it's really depressing. I did also point out the fact, you are going to work where there's going to be death surrounding you all over the place, but also she said there is so little support or any form of counselling, or that is a massive absence from the actual workplace.
But were it a more where we would want it to be, it'd be a bit of a different animal, wouldn't it? People would have more time, they'd be able to socialise with the patients more. The patients could actually get out and see a bit of greenery. I'm not saying these things don't happen, but they don't happen a lot, and I'm sure they happen a lot less, in the sort of world we're talking about now, than they might have done in the past.
That's the other thing we haven't really touched upon, the fact that hopefully a sort of a worker-led NHS would also, in some respect, be co-run by the users, by the patients themselves.
Definitely,
yes.
Yeah.
Yeah, that hasn't been mentioned, and it's very important.
Yeah, that's right.
Very important.
Yeah.
I think in some ways that they're far more sensitive now to, slightly paranoid really, to telling you what's wrong with you, explaining it in details before they just, here, take this. That's partly due to the use of the internet. People actually look up their own illnesses before they actually go to the doctor. So they might know more about, well, on a superficial level anyway, more about it than their GP.
But there's also
as you as someone said, you weren't even allowed to look at the notes in the old days, and then there has been some pressure now, so they do have to explain themselves to a certain extent, but there's still a long way to go, I think. And the other thing I want to talk about really is, perhaps we should be thinking about what's happening in some places, like in Latin America, where there isn't really a health service at all. People have tried to create various health centres themselves, controlled, with workers, shanty town dwellers, linking up with progressive doctors, that sort of thing. Maybe we should be looking towards that. Developing our own self-managed health services, if at all possible. Because if they're cutting the health service in Britain now, we should be maybe thinking about constructing alternatives.
Yeah, actually, just to give an example of what you're talking about, especially in Brussels, I do criticise these people, but the Workers' Party, they say, well, they're really linked to the initiative, but it's basically people's doctors, I think, and in Belgium it's not free at the point of entry, but you get a lot of it reimbursed through an insurance, basically, which is state sponsored. And
same in France.
Yeah, so it's the same sort of model, but basically this is a bit what we're talking about. It's run by the doctors and implanted in the local communities, and which then has sort of corrective feedback from what is actually needed by these people, and is actually addressing the fact that although there is an insurance base, a lot more people are not actually covered by it, and a lot of doctors know about it because it's proven to be very effective at actually getting to the people who really need the help. To go back to what you're saying, people know who's ill, who's suffering from what, and they actually go to the people. They break that sort of divide, and their major problem is lack of funding and equipment, but a lot of very passionate people and doing a really good job. So I think another alternative to organise this would be very effective, and I'm sure if I knew more about healthcare, there's probably lots of experiments all over the world, probably to back up this argument.
Yeah.
But I think you can have like low-level healthcare, if you like, of people supporting each other. That makes a big difference. Just being neighbourly, people looking out for they've got an elderly neighbour, they see. They check in on them, how they are. Can I do shopping for you or help out? Even that is low-level healthcare, because they are. When you were talking about both work and being on the dole or crap. To me, the major difference is, for most people, the major difference is social contact, because often when you boil it down, unless you're in well-paid work, there's not a huge difference between being on the money-wise, necessarily a huge difference. But the main thing I think people miss is the social contact. If you're on the dole and you're not really getting out much, and you feel funny about going up the pub because you can't, all that stuff is missing. Whereas in work, okay, you are at least seeing people every day, and hopefully you've got some friendships within that and what have you. So I think that the human I know from my experience, I'm sure other people probably do as well. One of the things that the elderly, for example, obviously they do, when people get elderly and are living at home, they do need some support getting out of bed or whatever, or help with the breakfast or laundry. But from talking to people, and from my dad, I know that one of the things they value the most is just having someone to chat to, just chatting to someone, and that, again, that's one of the awful things about this awful 20 minutes that's really 10 or 5, they hardly see someone. They have to just scoot in, they do one thing, then they're off,
Another thing beyond just social contact is the fact that the benefits claimant is such a stigmatized role that it just stresses you out being in that position and trying to prove to society that you're worth it. You're at the same time you're having this sort of like extra surveillance, increasing surveillance on your sort of day-to-day activities. I don't know what they've increased it to now, but you used to have to sort of report every few weeks, but I've heard that they've increased it quite a lot now. I can't remember what it is, like every few days or so. So just the role of it itself, even without the isolation, is I think quite psychologically stressful. And it sort of goes back into what we were saying, like how all of these issues sort of like they're entwined in. We can't really just look at healthcare on its own, because health is something that goes through our entire lives. It goes through absolutely everything. And I mean, I wouldn't want to be like deterministic about it or anything, but I know I was recently working in a community mental health team, and it doesn't seem like a coincidence, but the head consultant psychiatrist was saying that we're having more referrals now than at any point in our history, and it's increasing like week on week. It doesn't seem like that's a complete coincidence, given increasing cuts leading to like worse housing situations, more homelessness. Those things have an exacerbatory effect on people's mental health, and that then folds back onto then you're more likely to have problems with housing and homelessness and crime and everything. And it's
But also, I mean, there are sort of waiting lists for, say, I don't know, say you need counselling. Obviously, by definition, if you need counselling, you need it reasonably quickly, isn't it? And you're told, it's the waiting list. Unless you pay for it yourself, you're going to have to wait several months to do it. It's just mad.
Yeah, no, I wanted to add about the mental health issues going clearly on the rise. I think to link back to also what's happening, with the whole privatisation, it's just part of, commodification and marketisation of more areas, like more spheres of human activity. And I think the more that happens, the more, the humane side, the social interaction, is replaced through interactions through commodity-based relations, or marketized based relations. We're going to see it go up and up. And so I think that is for me one of the big things that we should fight on is this encroachment more and more into every area of our lives of the logic of capital and profitability, etc. Because even actually from an economic standpoint, the fact that making the users pay for healthcare decreases disposable income that we could go spend on shit we don't need. I mean, even from their point of view, it doesn't make sense forcing the cost of social reproduction onto the workers, because where are they going to get their effective demand from if we're paying £120,000 to have an operation, like in the US or something, So even from a reformist point of view, or from somebody who's in the system, it doesn't even make that much sense. Unless, you're a capitalist. But even then.
Well, I think without getting too much into sort of conspiracy theory sort of territory, if you have that kind of situation where only the rich are able to pay for their things, and you create this new dependency of the poor, and you put them into huge amounts of debt, if you have a privatised prison system like they do in America, they need a constant supply of people, so it doesn't particularly matter as far as the state's concerned if there's this huge disparity of wealth which creates a huge underclass. In fact, that's quite useful for the state as far as they're concerned. They have a large pool of people who are likely to find themselves in prison, because then you've got another pool of labour that you can, etc. So not that I think anyone is pushing that necessarily, but I think that's sort of the logic of that's the general sort of dynamic, the way the world's flowing, and that's obviously where America's at now, and it really wouldn't surprise me if that's the direction we start going towards.
Yeah. There is this thing where, because on the one hand there's like the NHS, or our NHS, which has got like a halo around it, and no political party Party can touch our NHS. It all has to be done by the back door. And like, if you were like a Martian looking down on Britain, you might think to yourself, they must really, really care about ill people in that country if they love their health service so much. But on the other hand, you know, if you look at the way that people with health problems are treated, not only are the way that they're not valued, the way that, I mean, like a friend of mine who has multiple sclerosis, which you don't get better from, got thrown off her incapacity benefits because apparently, you know, she might get better.
What?
Okay.
Yeah, and this is, yeah, and she's just, you know, and people with chronic health conditions are just being, you know, they're on like a sickness benefit, then they're put on job seekers allowance, then they go back, and just like the way that individuals with health problems are treated compared to this sort of glorious, it's almost like, and the way that, you know, there is a, you know, as you were saying, there is a stigma around approaching the NHS with conditions that are triggered by certain, you know, like if you're overweight or if you smoke or anything. And I mean, I suppose because I briefly for about, I don't know, 3 or 4 months, I worked as a care assistant in a hospice which was run by a charity in Ireland, so there was no, and like, you know, they used to get loads of money coming in because everyone went in there was going to die, and they usually left with a lot of money in their will, so like money was kind of no object. And it was the closest I think you could see to something that was genuinely patient-centred. And it did exactly that thing that you were talking about, where like, you know, 'cause if someone's got days or weeks to live, then kind of nothing's too much trouble for them. And we used to take them to the pub, we used to take them down the, yeah. Because like, you know, if someone's going to die in a couple of weeks, you're not going to say, actually, no, you can't have a pint. Sort of thing. But the staff to patient ratio was almost 1-to-1. And it was accepted that like, if you spent an hour or half an hour in someone's room talking to them, that was not wasted time. You know, everyone's, you know, I'm making it sound quite romantic. Everyone's contribution was valued to patient care, whether they were like the head doctor or a care assistant. You know, everyone's contribution was valued. But then they had so much money. It's odd, they had so much money that they were almost outside capitalism. You know, that they weren't part of the Irish state health system. They had so much money that they could basically just design something that came very close to meeting patient needs, and they involved the patients in it as well. But it's, you know, and this was a hospice that had, I think it only had 20 beds. 20 beds, about 40 staff altogether. But like, to need that amount of income to be able to provide something approaching what everyone should get.
But yeah, no, but that, I would say that's a question of resources, because obviously you need specialist health people, you know, with the skills to support those people. But I'd say the primary need was people like yourself. You could go in, you're not, I mean, Mr. Neurosurgeon, are you? So just the having people to go in and talk and strike up relationships with people, that as someone was saying earlier, it's equally important. All the jobs in the hospital are equally important. It's no use having fantastic doctors and nurses if the hospital's not kept clean, you know, or whatever, or people having crappy food. You know, they're all those jobs are equally important. Like Nick was saying, when I worked in the hospital, the bloody consultants were God, you know. It's driving mad. You're trying to take someone from a ward down to have an x-ray, and it's the consultants round, they're standing in the middle of the corridor with all the nurses, and you think, get them out, blinking way. I'm not standing here for 20 minutes while you yak, you know.
Well, exactly. The same thing happened to me.
Yeah. Well, sorry, I just remembered when I was looking at this cost benefit thing, they even try and put costs on psychological and emotional support. I mean, it's just nonsense, isn't it? those things are important, but you can't put cost on them by definition. I mean, to me, there is that sort of contradiction between the idea of money and care. They are, to me, they are two. Of course, we need money in this society, but they are two contradictory principles, aren't they? Because care is about realising our own humanity and seeing other people's needs and helping people and getting something out of it as well, because that's a human thing. And money is just about frigging profit, isn't it? Which is exploitation, which is anything goes, whatever you can get away with, and the profit arises from the difference between what it costs to do something and what you're making out of it. So that is always exploitation. To me, they are two totally different, contradictory things.
But yeah, I was just maybe going to add, that the staff at the NHS, although they are like frontline services, so it's hard for them to take action like all the ambulance drivers did for the first time. Nurses went on strike, so I think within the NHS the workers are starting, what I can see, and I have a friend who's a nurse in Brighton, are starting to try and organise and fight back. And I think as an anarchist, we need to lend or show our solidarity and our support and help them organise, help them mobilise, because they'll listen to them more than they'll listen to us, for sure. If the hospitals aren't turning, and it is still one of our most effective weapons against the ruling class. But they're gonna stop. They're gonna ban this sort of act, protests and strikes for frontline service people. So we need to act.
Well, they're talking about it, yeah. But you always get crocodile tears from politicians and people about, we can't have nurses striking. Funny enough, you don't get that when they talk about, we're closing a hospital, or it's a wholly different thing, isn't it? It's always guilt, that guilt thing. You can't possibly do that.
Yeah, it's a very effective weapon. You don't care about the dying people; you just leave them to die. Or, it's.
Well, we normally finish these about 8:30. It's now 15:15. So I don't want to put you on the spot, but I'm aware that you haven't sort of asked anything or sort of had a chance to say anything. You don't have to.
Can I squeeze through this?
Yeah, go on. Yeah, no.
Cheers.
Actually, I have a question. Who benefits from all these health issues? It's not only just drug companies. I think there is more, like a pyramid, like the drug company sits on the base, maybe some is up. So I think if we could do something to create the real to create something, we have to look at the up
Yeah.
and the top.
I think the big thing, like Alex had already touched upon, is it's sort of it's tied up in in copyright for drugs and intellectual property.
Yeah, intellectual.
Yeah,
Patenting.
A big thing is trying to see if we can scrap all that kind of crap. And I think there was a big thing a few years ago where South Africa ignored patents and things like that. I mean that's
Brazil, I think it was.
I mean that's got to be clearly something we can agitate around, or at least raise. Obviously.
Yeah, it's a transnational struggle that it goes beyond borders. And it is true that they are going further and further into patenting everything, including genes and everything. So this is something which even people who might not be revolutionaries are quite up in arms against. So it is maybe an issue on which to actually recruit and mobilise people on on a more revolutionary line. You know, it's a good entry point for a lot of people, at least from my experience. And you know, it's clear that that the fight needs to be taken to them too, rather than just focusing on the NHS.
You say in a way that you can't just look at the pharmaceutical companies, because that they're not the very top. I mean, for me, what if you want to sort of like look up to where that leads up to, that is just the logic of global capitalism. That's what that leads up to. It's this and all of austerity and cuts and the housing crisis and everything all leads back to this kind of this reshaping of the world, like the flows of capital of just breaking things apart and reshaping them in a way that's more beneficial to them. And that's for me.
No, I totally agree. And even if you look at pharmaceutical companies, they're not, the owners of those companies are the owners of other companies in other sectors. It's all interrelated. So I think the people to go after, but it's hard to organise such a struggle. But it is the most transnationally orientated capitalists. It's the multinationals, it's the globalising politicians, it's the media. Those are certain segments, but they're clearly part of the capitalist class who are now coming to define, a global agenda of reshaping, restructuring capitalism to favour, transnational capital. I mean, I'm of that opinion, but
well, it's a couple of you were saying. It's sort of this idea of enclosure. All the time capitalism is trying to get into more and more areas of our lives. It's always got to be doing that. It's just trying to colonise every area of our lives to see how it can make money out of it. But I mean, there are possibilities there as well, as you were saying. Like there have been things that have been won in terms of countries like India or parts of Africa or whatever, saying, look, we really need drugs for AIDS or something, we and it's ridiculous. You can't be charging those prices, the silly prices you're charging in the West. We've got loads of people dying. We need. Well, as you said, people have just flouted the law, haven't they? And just said we've got the formula. We're just going to make things.
Actually, in the case where I know of the case of Brazil where it did happen, where it was, I think it was an AIDS crisis, in their constitution they had a clause saying, well, in case of, humanitarian crisis, you can bypass these laws. But then what happened is a bit like under what we would have under the TTIP, is like with the WTO and all of that, Brazil was taken to, the Investment Settlement Tribunal, whatever it is, and they did have to fork out a shitload of money. Not as much as they would have paid for the drugs, but it was settled out of court, because even for the company it was a bit like, that we might not, let's stay away from this and do it behind closed doors, but they didn't get away with it per se. I mean, but I think there is something clearly there to act upon and to scale up that sort of resistance to it, because it's life, health, it's... That doesn't get people on the streets, what will.
Well, in a sense, it's about the most important issue, in the sense that it's, if your health's not good, that just ruins everything else, doesn't it? You need a reasonable sort of state of health, really.
I mean, where I live in Lewisham in South East London, the local hospital was under threat, and it's quite a big hospital. Actually, it's built in a former Victorian workhouse, another state institution we wouldn't be entirely keen on. But they managed, just in 2 big demonstrations, the biggest of which was about 30,000 people, far, far bigger than anyone expected. But the way that campaign was, because the thing is, because there will always be small local save at hospital demonstrations. The difference with Lewisham was that it was because of the private finance initiative, and the next door hospital had been run very, very badly, so they were going to close down Lewisham to save another NHS trust. And and the guy that had done it, this guy called Matthew Kershaw, had previously run his own private healthcare company, and by cunning use of the internet, it was discovered that he'd been at a presentation from McKinsey, who are a global firm of management consultants. So like McKinsey have their model of how public health should work, and they'd presented this to like senior NHS managers in London, and the proposal that he came up with for Lewisham and the NHS in South East London was basically McKinsey, and it was the McKinsey model of how you should run. So like all this stuff around this thing with austerity of like, you know, like never waste a good crisis. This is an opportunity to pull apart services that people need, because for years and years and years people have been hammered so much that they don't feel they're in a position to fight back anymore. Now that, if you like, that campaign became very, very sort of, you know, they put all their eggs into the basket marked legal challenge, and it went all the way to the High Court, and the High Court ruling was actually the special NHS administrator Matthew Kershaw does not have the power to close down this hospital. So Lewisham Hospital was saved, but then the law was changed.
Exactly.
And special administrators were given the legal power to do exactly that. So that kind of shows that you have like, you know, you have people prepared to get out onto the streets, but you go down the legal route.
Yeah.
And it's, you know, it's like the Howard Zinn's thing with a casino. You know, like you can go to a casino and occasionally you get a result, but the house always wins. And you know, there's
and actually, just to add to what you were saying, I think in the 2011 reform, the laws that the Tories and Lib Dems passed, I think it does actually fundamentally modify the responsibilities and obligation of, you know, well, it's not the Ministry for Health, but you know, for the head of the NHS, but at state level, government level, to actually ensure healthcare for the population. They've actually even modified the basic tenets of the NHS to facilitate this sort of thing, where centralise the power and give it even more to the managers and ultimately to the state and, you know, and capitalist class in the end. So.
Well, interestingly, I think it was yesterday there was an announcement that the partitioning Manchester NHS, so it's got its own separate budget from the national NHS, and the view is, well, I mean, typically anything that George Osborne touches on, I'm very suspicious.
This is constituency. This is constituency.
Yeah. Well, the thing is that they're saying that they're trying to merge two pretty much bankrupt institutions and then give Manchester Health Service a budget, which unfortunately will restrict the NHS. Well, from my understanding, will restrict the NHS as a thing that's probably free or whatever, or semi-indefinite, I guess. It seems to impose its own limits on the whole thing.
Yeah, I think as well it's a way of saying, oh look, we're giving local people power, but even within capitalism, they're only being given the power. It's not like, as I understand it, they're not being given money raising power, are they? So they will be given X amount of money. That's the budget for Manchester NHS or whatever, and then they can decide how they spend it. You know, so I don't know. It's a way of dressing things up. I think it's similar to, at the moment they're merging health and social care. Well, I'm quite clear they're merging health and social care because there's two different areas and they're going to operate under one smaller budget. But it's also, the idea as well is to, again, it's our old friend Karen in the community. It's, you know, let's get away from institutions, because institutions aren't nice to individuals. If you have individuals and they all have their personal care plans and their personal care budgets, which are going to be smaller, and then they decide how they spend their money, and they end up with less of a service and a smaller service, and the workers end up being paid less, you know. So there's all they try and dress things up in terms where it's hard to argue with them, you know. Who would argue against choice? You can choose. You can choose what hospital you go to. Who wants to choose what frigging hospital they go to? If you're unwell, you want to go to your local hospital or your, the nearest local thing that tackles what. You don't want to be told there's a brilliant one 50 miles up the road. It's complete cobblers. It's not analogous with other things, is it? It's like this thing of middle class parents, choosing all these schools or whatever. People need a local decent school for their kids, and all schools should be good, but so they're always dressing things up in a different way so it all sounds whatever. No one's against, you couldn't possibly be against choice, well, there's some things where you don't you just need your local resources to be good, don't you? It's just
and then I think it will probably, that sort of policy will also probably reinforce uneven development and hit certain communities a lot harder, and really reinforce this, because it's
any words of summing up, words of wisdom?
Well, I think, just broadly, I think hopefully we've agreed from what people have said, that obviously we need to defend what we value about National Health Service and things like that, but we need to look at the content, and I think we have reasonably clear ideas about what we'd like to see in the future, and it's not sort of the NHS without the cuts. It's a different animal that is a lot more people based and a lot more about people knowing about their own health and about valuing the staff who work and about the staff and the patients working together.